Hi, welcome back to my channel. In this video, I'm going to simplify about Vigabatrin. I'm sure you've heard this name and that's where you are here. Vigabatrin is an excellent anti-seizure medicine. It is used in children in one condition called epileptic spasm. It is also used in adults and also in children for drug-resistant epilepsies. So let's simplify on how it works. GABA is a neurotransmitter produced in the brain. It decreases the excessive neuronal signals. Obviously, the brain has to clear it out by an enzyme called GABA transaminase. Vigabatrin blocks this enzyme, thereby the GABA levels increases and it reduces the abnormal excessive signals. In simple English, this turns down the volume of a very loud speaker. It's quite safe and effective. Obviously, every medicine comes with side effect. I'm sure you're concerned about it. Let's speak about it. So this comes as a powder. You have to mix it in milk or yogurt or even in water. Give it twice a day. Pregnancy and lactation are conditions where you should preferably avoid unless there is no other alternative. And this decision is based on a case-by-case basis. Always speak to your doctor. Other than that, I think Vigabatrin comes with common side effects like drowsiness, irritability, and also sometimes weight gain. I guess you're all worried about its effect on the vision. I think you can see the site here and you're focused on the vision. This is what happens when you read on the Google. You will usually get this as the primary concern. Yes, Vigabatrin can cause a visual loss, a particular condition called reduced peripheral field of vision or tunnel vision. In simple ways, if you look straight, your field of vision is up to here, almost 180 degree. In Vigabatrin, when it is used for a long time, it reduces the field of vision. This is very commonly identified in adults because it is easy to test in the adults, and also it depends upon the dose and duration of use of Vigabatrin. Sometimes it is known to cause significant reduction in the field of vision and a disability. That is where when we use in adults, we always counsel about difficulty to drive and also sometimes limitation in the activity. Somebody who needs to have a good field of vision like multitasking, driving, it becomes difficult. In children, unfortunately, two things. One is we can't test them, and secondly, it is used for a short while where the benefits outweigh the risk. But many times parents are worried about this potential side effect. Also, the other challenge we find in children is many of them have visual problems because of, say, a birth injury. There is some condition called CVI. We don't know if the visual loss is already there because of the underlying problem or the visual loss gets worse because of the medicine. And testing in children is very difficult. But you need to understand the benefits outweigh the risk. So always discuss with your doctor, clarify, understand why it is being used and what are the benefits for the child. And many times it is used for a short course only. So you need to understand this before you start worrying about the side effects. Another side effect which is often popped up on your Google searches, reversible changes on the brain. There are some changes which happen on the brain MRI, usually in children less than 6 years, and it is reversible once you stop the medicine. So this information should be sufficient enough. If you need more information, you can always reach out to me. Overall, Vigabatrin in summary is an excellent anti-seizure medicine used predominantly in treating infantile spasm in children and also in treatment of drug-resistant epilepsies. I hope this information is useful and insightful. Thank you.